Breaking news from the science community has challenged the way cancer treatment has been prescribed for years. Recent studies have suggested that one's circadian rhythm, the internal clock that dictates one's alertness, plays a role in reacting to radiotherapy. For those who may not be familiar with the term radiotherapy, this type of cancer treatment uses energy from X-ray, gamma rays, and other sources to shrink or damage cancer cells. Breast cancer patients are commonly prescribed radiotherapy as a means of treatment, but this comes at a cost. Radiotherapy poses both short-term side effects, such as the redness and peeling of the skin, as well as long-term chronic pain or permanent skin thickening. These side effects can be mitigated with simple genetic testing, allowing for treatment at specific times of day. So why is personalized medicine so important? One variable in which scientists are currently studying is the amplified effect that radiotherapy has on genes. A gene that has sparked interest is one that is responsible for DNA synthesis, RRM1. Through the use of a PanScan assay, scientists at Yale University were able to genotype thousands of SNPs and monitor the effect that radiotherapy has on genes and variants of interest. They hypothesized that due to cellular radiation damage, RRM1 could enhance the survival of tumor cells post-treatment. They predicted correctly. In the case of protecting this RRM1 gene from radiation damage, a certain frequency of radiation can be administered to one's tumor cells, understanding that thresholds may be higher in patient X but lower in patient Y. Knowing these thresholds can maximize the benefit from this form of cancer treatment, affecting a minimal percentage of healthy tissue. A new clinical trial led by the University of Leicester shows exciting advances in the oncology world. REQUITE, a study designed to validate predictive models and biomarkers of radiotherapy toxicity and has also been used to reduce side effects and improve quality of life in cancer patients, has released data that might change the standard of practice. Taking into consideration each patient's aforementioned circadian rhythm, study participants are genetically screened and treated at varying times of the day based on genetic results. In November of 2018, a brief article highlighting the promise for breast cancer was released. This article noted two main genes, PA3 and NOT, which showed a significant reduction in radiation side effects if those patients were treated in the afternoon. We now look to Dr. William Chu, a Toronto-based radiation oncologist, for his thoughts on the topic. In your practice, is genetic testing prior to radiation therapy part of standard care, and if not, what is the main reason?
In my opinion, there's nothing more personalized than a radiation treatment plan. Every patient has a specific and customized plan designed to treat their tumor. No given plan is exactly the same. With respect to genetic sequencing for cancer treatments and radiation treatment, that's still in the research phases at the moment.
As a radiation oncologist, does the current data released by the REQUITE study interest you and show hope for changes in future standard practice?
Early studies released by REQUITE are quite exciting and certainly generate a lot of interest and will potentially shape the future of how we practice radiotherapy. At the moment, we try to minimize any excess dose or high doses of radiotherapy to the adjacent normal tissues. They will be exposed to some lower doses of radiation, and details and studies and research and findings from studies like REQUITE will help us to better understand the potential impact of even those low doses of radiation treatment on our normal tissues, and potentially help further minimize any long-term toxicity for any given specific patient.
In the science community, technologies for administering radiotherapy has rapidly advanced, while there has been less progress in reducing side effects. However, recent discoveries, including the PanScan assay and REQUITE, attempt to adopt a more personalized approach through genomic testing, in hopes to alleviate these side effects. Personalized radiotherapy treatment options ensures that patients undergo a more tailored, less toxic and more effective care,